Hello, nice to see you again. We're back, as every day for the past month, with Mark Thomas, author of 99% Business Strategist. I like to call him neo-genius, but he doesn't like that too much, so I won't today. We're talking about a serious subject today, Mark, which is COVID, coronavirus, and what our government and the UK, how it's been responding. I'd be interested to know your thoughts on that, coming, I suppose, really from a management context.
Well, yes, from a strategy perspective, I think it's been a case study in how not to think strategically and what happens if you keep changing strategy all the time. In principle, there are only 4 types of strategy that you could follow.
Okay.
So I think we've got a picture here just to explain
Here we go.
how to get there.
Yeah.
So if you ask yourself, first of all, will we allow rapid mass infection? Is our strategy going to do that? The answer is either yes or no. If the answer is yes, then you go up to the top part of the diagram and you have a second question, which is, are we going to allow that to happen through all segments of the population?
Okay.
So if you say yes to that, that's what we've called the laissez-faire strategy. That's basically saying, well, we're not going to do anything. We're going to let it run.
That sounds quite familiar. Okay.
And Boris Johnson talked about taking it on the chin. That would be that laissez-faire strategy. You basically don't intervene. If you say no, then you could intervene in some way, but you're still letting it rapid mass infection. So you're just simply going to isolate the most vulnerable people. So those are the first two possibilities.
I've heard people saying that a lot recently. I mean, it's probably the predominant voice in the Daily Mail, which is basically, isolate the vulnerable, but other people have got to get on with their jobs for the benefit of the economy and those people who keep Wetherspoons in business and so on.
Exactly. Alternatively, you could say, no, we're not going to allow rapid mass infection. Obviously, the reason why you might consider saying no is that it does kill roughly 1% of the people who contract it. And so if you allow rapid mass infection, you are going to have 1% of your population dying, which is a lot of people to die. It's comparable with the number that were killed during the Second World War. So it's you would think a government would give serious consideration to saying no to that first question.
Yes.
So if they do say no, then they've got 2 further questions, which is, will we aim for complete containment? And if they say no, then what they're saying is, well, we're not actually going to try and stop it spreading. We're just going to slow it down so that it doesn't completely overwhelm our capability to treat it, which is, we've heard the phrase a lot, protect the NHS.
Yeah.
What they mean by that is not in any real sense protecting it, but just making sure that there aren't 10 times as many infected people as the hospitals can possibly cope with. So we don't have hundreds of thousands of people dying, gasping for breath at home with their families or alone in their flats. We don't have that picture. We have people going into hospital and dying. So we call that strategy retard for treatment. So the retard strategy. And then the final one is the one which the most successful countries around the world adopted, which is to say, yes, we're going to lock down, which will reduce the numbers to make them manageable. And then when they're small enough that we can effectively manage to test, trace and isolate anyone who might be infectious, we will then have snuffed out the disease. Now, it's not even if you achieve that. For example, New Zealand went down that route. Jacinda Ardern talked about going in hard and early. They locked down when they had very few cases, and they shut down the whole economy very briefly, and then they said, okay, now we can eliminate it because we've got very few cases left. The numbers are so small that it's easy for us to trace them. It's easier for us to isolate those people and support them in isolation. And it's we're not going to. We're going to try not to re-import it. That's the problem, because even though they're an island, people still fly in and out, and so they have they have had to be continually vigilant because they have reimported cases. So when we say lockdown and eliminate, it's not eliminate and then relax, everything's completely back to normal. It's we can open up, but we still need to try to prevent reimportation, and when it happens, we still need to be able to snuff it out again.
Yes.
And so even that strategy is far from perfect.
Yes.
But those are the 4 strategies. Now, I think the question you asked is, what is the government's COVID strategy?
Yeah.
I think the answer is, well, they have shifted around without ever settling on the most sensible strategy. And that's still, I think, the case today. So I see you've got a quote up there from Boris Johnson.
Yeah,
so this
let's
is
have a look at it.
He made in Greenwich I think it was the 2nd of February. And he was saying, there's a risk that coronavirus will cause overreaction. So what humanity needs is a government which is willing to put the economy first, in effect. And the words he used were take off its Clark Kent spectacles, leap into the phone booth, and emerge with its cloak flowing as the supercharged champion of the right of the populations of the earth to buy and sell freely among each other. And here in Greenwich, in the first week of February 2020, I can tell you in all humility that the UK is ready for that role. I love the way he used the word humility in that final sentence.
I don't know who believes this rhetoric anymore, actually. I find it quite offensive, Mark, that people can talk like this, let alone the British Prime Minister.
Well, the reason it's offensive is because essentially that speech makes it clear that he wanted, at that point, early February, he didn't want to have any kind of lockdowns. He wanted to let the British people buy and sell freely among each other. And, we would, with all our British pluck, allow 1% of our population to be killed rather than slow the economy down. Now, I think what happened was in early March and mid-March, people started to publish what this would actually mean in practice. And there was an Imperial College paper which was published on about mid-March, which spelt out very clearly that we would be talking about hundreds of thousands of deaths if we did that. First of all, he then toyed with this idea of saying, well, we'll just safeguard the elderly then, which of course is impossible because, you've got elderly people in care homes who we know were we know they were hit very badly. But the problem is, of course, they don't live in care homes on their own. They are visited by members of staff who have families, and those staff members can't isolate away from their families in order to be sure that they're not going to risk transferring the disease into their care homes. And it's not even that the staff are always permanent staff. A lot of them are agency staff, so they can move from one place to another. So even if you handled it well, isolating the most vulnerable is an extremely difficult thing to do. And so, this is a Guardian headline that describes it as blunder after blunder, which is harsh, but probably fair, because, we did have a lockdown and it was late. Before the lockdown, the virus in the UK was doubling roughly every 3 to 4 days. So that means every week of delay, it would have doubled twice. So there were at least 2 weeks of delay, which means that the number of people who got the virus before lockdown was about 4 times more than it should have been. So, at that point, according to the FT estimates, by the end of lockdown, there had been 65,000 deaths. Quite possibly around 3/4 of those were needless deaths caused by the delay to lockdown.
Okay, so
once again, it was a blunder.
Okay, you say blunder. Once again, the impression I'm getting here is of gross incompetence But also, I mean, it's not just a mistake. It's not just really bad management. It's something more. I mean, you know, newspapers like The Guardian, for example, here we go. They did a pretty good, well, they've done fairly good running commentary on this whole thing, actually. There's a very big piece they did in The Observer. And it's pretty clear, actually, that despite whatever denials are said now, herd immunity was the plan. That was the plan to begin with, don't you think?
Well, I do, absolutely. I don't think so. If we look again at those those four strategies, three of them are effectively herd immunity. Laissez-faire, absolutely. Yeah. You're not doing anything other than relying on herd immunity. Same with isolate the vulnerable. But even with retard for treatment, essentially what that means is, well, we're going to contain it, but we're not going to actually eliminate it. So it's going to continue marching through the population until either we have vaccinated enough people or we've reached herd immunity. Now, as it happens, we may be getting close to a vaccine, and hopefully, you know, it's a matter of months rather than years away. And therefore, even with this retarded strategy, the death toll will be less than it would have been with if we had just acquired herd immunity naturally. But yes, I think you're right. There seems to be quite a lot of evidence that was the policy, and apparently Boris Johnson said that explicitly to the Italian Prime Minister, and Matt Hancock said the same thing, also to an Italian political leader at one of the G7 meetings. So there seems to be a lot of evidence that herd immunity through infection rather than through vaccination was the early strategy. And I don't think they ever really shifted away from that, because if you look at the timing of the unlocking, we had not got to the point where the UK's ability to test, trace and isolate was ready to take over. In other words, the numbers, our capacity to do the test, trace and isolate was less than the numbers that were left. The numbers that were left were coming down and the capacity was going up. When those two lines crossed, it would have been safe to unlock, because we would have then said, okay, we're unlocking in general, but we have got functioning test, trace, isolate. You may be asked to isolate. We'll help you. We'll support it. It will all happen. And that would have continued the downward march of the virus. What happened was that they unlocked because the numbers were low and it was nice and sunny. And that has an impact, because it means people are so much more out of doors.
Totally. Yeah,
and
that's right.
Rather than being in a stuffy room where the windows are closed, and effectively, you know, if you and I were in the same room rather than at different parts of the country, you know, we would be breathing each other's air.
Nice.
How nice, and you know, how fatal, possibly. You know, summer helps. So they unlocked in summer, but then they decided to continue to relax guidelines, and of course to send people back to school.
And we all did Eat Out to help out as well. We courtesy again of Mr. Sunak, didn't we? I mean, we got sponsored meals out.
Absolutely. Now that was very clearly a blunder, I think, because restaurants, typically you're eating indoors, and it's well known, it has been known for a long time, that restaurants are the kind of setting where people can transmit it widely. Totally. So, you know, he could have said, have a takeout on me, which would have been a far more sensible use of the same amount of money if his objective was to protect the restaurant trade. So that really was a blunder, absolutely.
Yeah. Well, just walking down Baker Street, you know, over the past few weeks, I mean, I had poster after poster after poster, Eat Out to help out, get back shopping, go and have coffee with your friends. These are government posters that people like you and me pay for with our tax money. And now the posters are saying exactly the opposite. I mean, this is a complete cock-up in terms of management. But I want to ask you about one little phrase here on your option chart, which is it's clear enough for even me to understand, and possibly Boris Johnson too. Right at the top there, laissez-faire, laissez-faire.
Yes.
Now that's not just a description of their COVID policy. I mean, this is where ideology meets science, isn't it? Really, because laissez-faire is part of, dare I say, a right-wing agenda. So to what extent do you think, and it's an imponderable, but what extent do you suspect that actually government health policy, public health policy, has been influenced by political ideology?
Well, I suspect it has been. We've got an article on the website called "How Did We Get Into This Mess?" and it looks at some of the blind spots that I think have been the reason that the government hasn't chosen a sensible strategy, a root cause, if you like.
Yeah.
And several of those blind spots are to do with the ideology. First of all, as you say, this idea that you should really not interfere with the economy if you can. Well, you just shouldn't do it, actually, which nudges you towards laissez-faire, not just economically, but also in this medical sense here. But also some of the other things that have gone wrong, their choice of suppliers and their choice of people to take high-profile, responsible jobs, where rather than pick somebody who's got a distinguished medical history and handling infectious diseases, but whom you didn't know when you were at school, and therefore you haven't got a sort of bond of personal trust. You go with the banker or the telecoms manager whom you have known for 30 years, and therefore you've always thought he or she was a smart cookie. So
it's a bit like Trump, isn't it? It's a bit like Trump, appointing his family to all the key positions, or a Roman emperor, because they're the only people they feel they can trust. I mean, this is by no stretch of the imagination good management. I mean, I find it offensive on those terms alone. It's just very, very bad management.
It is. It's appalling management. And, people talk about diversity. The argument for diversity is that when you've got a difficult problem, you want the best talent to fix that problem for you. Absolutely. And it doesn't matter which school they went to or what colour their skin is or whether they can walk properly. What matters is, have they got the talent to fix the problem? That's the argument for diversity. And if I recruit, but I only recruit people I went to school with, I'm sure I went to school with some clever people, but they're not going to be the A team to solve a crisis like the coronavirus sweeping through my country.
No, quite extraordinary. Thank you very much, Mark. This is, again, another enlightening day. Mark's book is available on this link right now, 99.redhammer.tv. It's a short link. It'll take you straight through to the Amazon buy page where you can get it on Kindle or paperback. And as always, I exhort you, please, to leave questions for Mark right here on YouTube, and we will pick them up and throw them towards in his general direction tomorrow.